Hi, I'm Dr. Charlie Galanis, board-certified plastic surgeon in Beverly Hills, California. I want to do something a little differently. Rather than tell you about Mommy Makeover Surgery myself, I want to let my patients do the talking. In a two-part series, I'm going to share parts of a candid conversation I had with patients who share their unique experience with Mommy Makeover Surgery. Today, we're going to focus on the process leading up to the surgery, how they made the decision to go through with it, what that process looked like, and how their life has changed since having surgery.
I'd seen a video online about, it was an uppercut procedure, and it was a day surgery, like a day procedure, and so it was non-invasive and no anesthesia, and so I was like, oh, well, if I don't have to have elective surgery and if I don't have to have anesthesia, well, maybe I would consider it. And so I went in, I had an appointment, and it didn't feel right. I didn't feel like I was a good candidate, but they'd given me your name. And she spoke really highly of you. And so I went down, I had an appointment, and that was the first time I'd actually really considered having anything done. It just wasn't on the table for me. And just having that conversation with you really started me thinking about it. Mm-hmm. And the way that you presented what you did and what your goals were about just restoring to me where I was and having a natural look really, turned me on to actually having it done for myself.
That's interesting. What about you? What was it kind of your moment?
Mm-hmm. Well, I was pretty surprised that I even had the guts to kind of, research the possibility of doing this. And I had mentioned that I joined a few tummy tuck face group pages, and then I started following a lot of surgeons on Instagram, mm-hmm. and that's how I came upon you. And I remember the first day I came into your office, you said, I don't want to address what I think you need. I want you to tell me what you want to do. Yeah. So you made it more about like my interest and what I wanted to see for myself. And I initially came in wanting to talk about a tummy tuck. Yeah. But then we had also discussed the asymmetry of my breasts. Mm-hmm. And so we moved it up to Mommy Makeover, right. Which I am 100% so happy that, we decided on that together. Honestly, also, personally, I had just lost my husband, mm-hmm. and I was feeling really low in my confidence. Yeah. And I somehow had this notion that I would have to go out and date again in some respect, and my confidence was so low with my stomach and my breasts that I couldn't even visualize feeling comfortable around a man again. And with the surgery, I gained this whole new perspective on my body and how I felt, and just kind of like that mindset of that confidence of who I was actually really meant to be with my body, after all that wreck of having a baby and being overweight and to come to the point where it was actually improved so much, so drastically, it made me feel like a totally different person. It really helped me to go forward with my life, and it really put a new spin on my smile and just on what I was able to portray to the world, you know?
One of the things I love that what you're saying, and then what I love hearing and with what I do is, I think that, and I talk about this all the time, but I think it's a big myth that plastic surgery is about beauty. Yeah. I don't think it's about beauty. I think it has nothing to do with beauty. I think like all of you guys are beautiful when I met you. It wasn't like you needed to be made beautiful. And I talk about this a lot because what it is about, in my opinion, is confidence. It has everything to do with how we feel and not so much how we look per se, because how we look is a very subjective measure. Yeah. I mean, how we feel is too, but how we feel is more personal. No one can tell us how we feel. And when you kind of reiterating over and over again, confidence, that's one of the unifying things I hear across all procedures, whether it's a mommy makeover or lipo or breast aug or facelift, it's confidence. And the reality is most of the people I meet, they're confident people. They have an inner beauty and inner strength. there's a disconnect between what they see in the mirror and what they feel on the inside. And a lot of times what I think plastic surgery is about is building that bridge between the two. They have that confidence, they feel beautiful on the inside, but what they're seeing it just doesn't connect as well as, it's just not making that connection. So, I mean, is that kind of how you felt?
Yes.
Was it was it a confidence thing for you, or?
Yes, because as I had to fix my breast and in my stomach, and I knew I need help. I need to fix my body, and I knew it with surgery is the only option. But I didn't really realize how much I needed it until I see the pictures before and after.
Yeah.
And I was like, no, that's not me.
Right.
Before that's not me because I did not feel that way.
Right.
And I was always trying to cover myself. I didn't feel comfortable. And I always, spend more time in the closet trying to find something to cover myself.
Yeah.
And now it's the opposite. I still spending time in the closet, but now to find something nice and sexy to wear.
I love that.
So I love it, and my husband love it. Sometimes he makes fun of me because I don't go anywhere, right? I'm just at home, and I just dress up, and he's like, "Where are you going?" Nowhere, but I just feel good, and I just wanna,
Yeah, that's great.
and I love it. For me, it's the best thing.
I have to dig up that picture because I keep going back to this, but everything you're saying is described in that picture you sent us from the beach.
It's like,
you had your arms up like you were cheering and you were so happy.
Yes,
I mean,
I feel me again. I just feel like I love myself again, and I can love others. So now I'm like more happy with my husband, with my kids. I'm as you said, I can go forward to my life, and I just feel so happy. So I love it.
And something you said, and I think I've heard it a few times, is it's sort of turning the clock back. So, you were saying that's not who I am when you're looking before. Who you were maybe been before, or what you perceived as yourself was maybe before the pregnancy. But so a lot of what we're doing is we're not creating an artificial or different version of you. It's meant to kind of turn the clock back a little bit so it's still you.
Yeah.
It's not an identity changing procedure. It's like an identity affirming procedure in a way. And we talked a little bit about, for you, with the stomach and the rectus muscles, how that was that kind of the thing for you that was like, this is why I need to do this?
Yeah, I actually have another thing to add to my reason is my mom had the exact same thing happen to her. She didn't know what it was, and I think we just learned about it through me.
Yeah.
She just had a bulge in that excess skin and just basically very uncomfortable in her own skin. And I witnessed it my entire childhood of her, not like a little bit here and there when she put a bathing suit on, like not being comfortable. And I remember being like, wow, that's not cool to like not feel good in your own body, and she waited 20 years to have her surgery.
Yeah.
And I remember thinking like, that is what I'm not gonna do.
Yeah.
I wanna do it as, I would rather have those 20 years of feeling good in my skin and feeling sexy and wanting to, feel me again.
Right.
So that was my decision to like, right after I stopped breastfeeding my second, and you were like 6 months you have to, wait 6 months after.
Yeah.
I was like 6 months to the day.
You were marking the
Like
calendar.
I just knew that it was gonna be, watching her go through it and feel so good at 50.
Yeah.
I was like, this is gonna be amazing, and no looking back.
Perfect.
Yeah.
I think that as plastic surgeons, we give general advice on what patients should look for when they find a surgeon, and that may be valuable. I think it'd be more valuable for someone in your shoes to hear from you what you think is most important. On our end, we obviously say things like a board-certified plastic surgeon, someone whose results you trust, someone you have good rapport with. Those are some of the basics. If you were talking to someone who was looking at doing this and had no idea that I don't know who I'm going to find, what would be some of the things you would say are important? Well, in your experience, having been through what you've been, what are some of the things that you think are kind of crucial?
I think just that initial feel of trust. I think our guts give us a pretty good feeling about people, and just having that, like, is he going to have my best interest? Like when I'm on the table, like, is he going to do exactly what I wanted him to do?
Right.
Like, does he understand what my goals are? Like, does he understand what I really want? And I felt right away that when I told you what I wanted, you were on board and you wanted to make that happen. And I went to like 3 other doctors to get consults done. And the feeling that I got at some of the other places that I went was, well, maybe you think you want that, but I think you might want to go a little bit bigger. Like, you don't want to do all this work and then wish like you would have gone
Right,
bigger.
right.
So they were kind of pushing me, to go another way. And I'm so glad that I didn't, because I love my results.
Yeah.
And even when I came back to you and I was like, well, do you think I should go a little bit bigger? And you're like, no, I think you should just stay where you are. And I'm so glad I did,
Yeah.
because it's perfect.
Yeah.
So I'm glad that you were there to like rein me in and like remind me of what my goals were, and
Right.
just that initial trust,
Yeah, I
having my
appreciate
best
that.
interest.
And I think that, for me, it's a philosophy, is that it's, like we've kind of talked about earlier, this has nothing to do with what I think someone should do. It has everything to do with me understanding what you want for yourself.
Right.
What about you, Teresa? What are things that you think someone should look for?
I think definitely the rapport and the trust and the communication
Yeah.
that we build with each other. And the only way I can really compare it is by saying, with a few of the other surgeons, they looked at me and said, you need this, 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 and this. You were the person who said, well, what do you want?
Yeah.
What do you see yourself comfortable with having, and what kind of results would you want to? So you took a very different standpoint,
Right.
and you let me have a say in it almost, and kind of let me initiate my goals with the things that you would want to see as well. And
Yeah.
for those to mesh together was like a really great synergy.
Yeah,
So.
that's good to know. Thank you.
Yeah, for me, it was a little bit different, because since I met you, I knew I got the connection and I was ready to do the surgery with you. But
Yeah.
my husband, he wanted a second opinion.
Yeah.
So we went to see another doctor. And as soon as I get there, I'm like, no, I'm not doing it with him. And I told my husband, you see, I told you.
Yeah.
I got my surgeon already. I know, I'm so happy.
Each of you guys talked about experiences with different doctors. I don't know that you did, just because we knew each other.
Yeah, I didn't go to anybody.
So you're going to maybe have a little bit of a different piece of advice.
I do.
So what's
Well, the reason
comes
I
up
went
for
to you is, we knew each other. You did a procedure on one of my good friends,
Yeah.
and having that, I loved her result,
Yeah.
and that's comforting. I had a reference, and then I honestly think it's really cool that these days we have Instagram to
Yeah.
be able to see the before and afters, see you on video, and seeing how you present yourself, and those are just things for people to consider, and I think it's great that we have that, and then how you feel about those initial
Yeah.
consults and how they approach it. This doctor approached it in a very interesting way, in my opinion, maybe starting off with some negative
Yeah.
and then trying to, but I mean, it's an interesting, I'm sure for you guys more than me, because I knew him, it's scary, kind of going into that, but really seeing the before and afters, I think, are super important to I've really liked, because even I know you, I
Yeah.
wanted to make sure.
Sure, that didn't give me a free pass.
Right,
Yeah.
so I definitely did my time on, you sent me a couple things on some previous, before, because I think you had just gone on Instagram at
Right.
right around that time, but you sent me some things. I think that that's really important. And your entire approach about the whole thing, very humble about it, and allowing us to have our, say on what we want. And I told you same thing, I did not want to go too big. You definitely weren't pushing me, and
Yeah.
understood. I definitely wanted your opinion. You definitely have the vision of I don't know what that's going to look like inside my body though,
Yeah,
what
yeah.
this, how many cc's or whatever. So that was, I was really nervous about that, but you made me feel better about it.
I think the thing I'm picking up from all of you guys, even though you had different, you only saw me because you knew me. The thing that it's the intangible. It's that feeling you get with someone.
Oh, yeah.
So I think the only way, if you're giving advice to someone, is to see as many people as you need to until you get that.
It's a really important commitment and a really, life-changing kind of decision that you're making. It's almost like a marriage. You want to be sure that that's
Yeah.
the person you feel really comfortable spending that time with, and spending that surgery with, that experience, because I think the aftercare that you provide is really top-notch, and I just think that the communication was so good that I really felt that I couldn't get that with anybody else.
Yeah,
So,
I appreciate that. I
yeah.
think that one of the things I think is important is finding someone who takes the time.
Mm-hmm.
There are people that are busier. There are people that will try to delegate certain parts to different parts of their office. One thing I can tell you on my level that I want to always maintain, regardless of how busy or not busy my practice is setting aside the same amount of time as I did my first month in practice. Because that's your time to kind of set that rapport and make sure that it works for both people. It's the only way you're going to find out. I think before and afters they're important, but they kind of do a disservice to what it is that we do, because if you really believe, which I do, that beauty is an arbitrary thing and beauty exists before and after. So with that in mind, I'm kind of curious on your thoughts about the change that you've seen in your life, if any. Maybe for you, maybe for someone it's like, nah, it's the same, but whatever, I feel better. But what your life looks like having gone through this.
I mean, it definitely has a lot to do with the way I feel in my clothes and in the mirror, and just, that's like a huge part. I'll be totally honest with that. But it's also like how I feel when I'm, what I do for a living is I train people, and I'm in the gym, and I felt so disconnected, and I'm trying to bring awareness to people and their bodies. And when I don't have that, it felt very like I wasn't being authentic almost in my own self, with my own self. I don't know. It just has made me so much happier to feel that connection again, because it's so important to me.
Yeah.
And maybe that isn't to a lot of people, but it is for me. Like I have a deep love for movement, and I love that I feel really strong. And I've been saying, I think a huge positive of going through having diastasis and with the severity that I had, it's really allowed me to understand like how to engage my core and be connected. And it's, I feel like after the surgery, I'm like stronger than I've ever been.
Yeah.
Truly.
Yeah.
Like, because I've learned, and because you did such a great job, and I feel, like I truly feel really strong, and that's important to me. And it manifests in more than just like physical strength, like feeling good I think everyone should feel good in their skin.
Yeah.
So however that is, whether it's with surgery or not or whatever. So I personally felt like it was the best thing I, could have done, and I'm very happy.
Anya, what about you?
Well, for me, I feel like the before picture, I feel like it's not me. And now with this new body, I feel like my feelings and my body is the same.
Yeah.
I feel a connection with myself. So for me, it's just awesome. I just feel free.
Yeah.
That's cool.
That's how I feel it. Like I can wear whatever I want. I feel happy about myself. I feel good about myself. So it's just positive things that happen to me.
Yeah.
So for me, it's a new life. It's just amazing. I just feel free.
Yeah.
That's cool.
Thank you.
Thank you. Teresa?
Well, to bring it down to brass tacks, I mean, who doesn't want to feel amazing in their own
Totally.
skin,
Yeah.
And I think that word that you used, free, is exactly the way that I feel too. It's I don't have to worry about being so self-conscious all the time. I feel the freedom to wear, whatever shirt I want to wear, and not have a big bulge hanging out. And before that used to make me really feel embarrassed, and it made me feel really self-conscious about myself. And I think just the mental freedom that I feel with just having a flatter, tighter core and stomach, and just the symmetry in my breasts now, it's really changed my life, and just given me the freedom to
Do whatever you
do whatever I want to do, wear whatever I want to wear,
Yeah.
feel however I want to feel. I don't have to feel embarrassed or self-conscious or any of those negative things that I had felt in the past. I could now feel great.
There was a time at work, and it was after I'd had my 5th baby, and it'd been like a year. And I swear, every time I went to work, someone would ask me if I was pregnant. And I think it was like this ongoing thing, as I was always pregnant. So it was like, oh, they just assumed that I was pregnant. But this just kept happening over and over again. And I, so I would work out, I would eat right. And no matter what I did, like, I just still looked like I was pregnant. And like, this is how I'm gonna live. This is how I'm gonna live my life. And it's gonna be okay, I'll be fine with it. And so I thought that's what I was gonna do. And then I started looking into the breast thing, and I'm just so grateful that I did, because the way that, like they talked about, like the freeing, being able to wear what I want to wear and not have to worry, and being able to engage my core. It's so much more fun to exercise.
Yes.
Oh my gosh, it's amazing.
Yeah.
I love exercising now.
Yeah.
And I didn't know what having breasts were like before, because I didn't have anything.
Yeah.
And I was also asymmetrical, and so I didn't know what that was like, and they're amazing.
Yeah. You all referenced a little bit about what you look, what something looks like, but the thing you're all talking about is how you feel. And that's like, again, I hate to beat a dead horse, but like that's what it's about. It's not coming and saying, I look amazing today. I mean, you do, but you looked amazing before. It's about how the feeling is different. And I'm grateful for you guys, because I get a front row seat to that. It's part of my frustration in the before and afters is, traditionally before and afters don't actually, people don't respond as much to before and afters as they do to some of the fluff crap I put up on Instagram. I mean, it just doesn't. And I actually take umbrage to that, not as that I take it as an insult to my work, but because it shows me that people they can't see the change. You know, they see the visual change, but they can't see how you're smiling and putting things up on Instagram at concerts. They don't see you doing the beach picture. They don't see how much you enjoy doing exercise now. They don't see how you love feeling strong. Like, you can't put that in a before and after picture. So I'm grateful for you guys that I get a front row to that. And thank you. And Lauren, Tanya, Teresa, Valerie, thank you for all of this. This has been great. I think it's really helpful for me, but it's exceedingly helpful for people that can watch it. So thanks for sharing. I hope that video helped answer some of the questions you might have. If you have any more questions, don't hesitate to write them in the comments section below, over on our Instagram, or head over to my website, and myself or one of my team members will be happy to help you. If you enjoyed the video, give it a thumbs up. Please consider subscribing for more videos just like it. And until next time, have a great day. And remember, there's beauty in the before and the after.